We're getting an inside look tonight at just how bad things are in parts of downtown Vancouver's busiest aging hospital.
Last spring, St. Paul's announced it was going ahead with its plan to build a new facility. The plan is to move from the current Burrard Street site 3 kilometers away into a brand new building beside the Vancouver train station.
Now, many West End residents are worried about losing a world-class facility right in their neighborhood. And tonight, Randene Neill launches a new series on why BC needs a new hospital, which officials say will transform healthcare in this province. Up first, an inside look at why a new St. Paul's campus of care is desperately needed.
Yes. A typical day in St. Paul's emergency department, one of the busiest in the country. Hundreds of patients stream through here every day, some of them several times a month.
I'm kind of a regular.
How often do you come to the ER?
Well, I've been coming here too often lately.
Dr. Calla, we are ready for trauma 2.
Dr. Dan Calla heads the emergency department at St. Paul's. Dealing with recurrent patients is only one of the problems he says an old St. Paul's can't solve.
We're one of the most efficient emergency departments in the country, and we're very proud of that, but our physical plant is up to 100 years old and our space is jury-rigged together. Lift up.
Even on quiet days, the old infrastructure throughout the hospital can be a challenge.
Yeah. If you're not functional, you're paralyzed. And we've seen that before where, we have the human resource capacity. There's nurses and physicians ready to take care of more patients, but there's just not the space to do it in. And that is quite disheartening, demoralizing, and at times, to be honest, it can be a bit dangerous for the patients.
St. Paul's was built on the Burrard site in 1894 as a 25-bed hospital, and in the last 120 years, it's been expanded, updated, and renovated, and never shut its doors. It's become a center of excellence in cardiac services, HIV/AIDS, mental health and addictions, and kidney care, to name just a few. But in 2015, the 2.6-hectare site is on life support. The hospital's sewer pipes are at capacity. 440 patients are crammed into 4-patient rooms. The Comox Street building, built in 1930 as a nurse's residence, now sits empty, condemned, full of asbestos, crumbling brick, and leaks. A 2011 report on the state of St. Paul's listed it in deplorable condition and at risk for cataclysmic failure.
You can't renovate into a modern, world-class facility. There's just too many obstacles here. For example, this 1912 building has 10% seismic capability.
Neill McConnell is in charge of finding a solution, and he says there's only one.
Would it be possible to make this site new again? And the work that was done by ourselves and our consultants shows us that we can't get it there. For example, we cannot get more than about 50% single rooms on this site. And modern healthcare is at least 80% single rooms.
The solution? A new site 3 kilometers away. Hospital staff say it's long overdue.
I've been at St. Paul's now for 16, 17 years, and I've seen some of the same frustrations repeated, and I share them with the patients. We often feel helpless as the doctors on the other side, and the idea that there might be a new and better way to treat patients is very exciting for a veteran emerge doc like myself.
Amazing conditions that they're working in there, Randene. So obviously no way to rebuild a hospital on the current site, but wow, what a plan for a new one.
Absolutely, Chris. And that's our focus for tomorrow's story on the NewsHour. Providence Healthcare has already purchased that site that you saw. It's paid for, and it's almost 3 times the size as the current St. Paul's. So tomorrow we'll tell you how much the new hospital will cost, who will pay for it, and what residents want to know, what happens to the old St. Paul's on Burrard Street. And remember, this is BC's hospital. More than half the patients at St. Paul's come from outside Vancouver for its world-class care. So we'll also tell you how St. Paul's plans to transform the hospital into a world-class campus of care, complete with a new birthing center, a center for dementia sufferers, and a mental health and addiction center. Chris.
Look forward to that on the NewsHour tomorrow. Thanks, Randene.